Hello friends, welcome to my channel Pathology Master. Myself Dr. Parth and today I am going to teach you one important topic from the cell injury, that is the reversible cell injury. So let's start the discussion of the reversible cell injury. Okay. So what are the learning objective as per the new curriculum? So our learning objective for the today's topic of discussion is to understand the basic mechanism, means pathogenesis of reversible cell injury, means how the reversible cell injury happen in our body. Then you need to understand the morphological changes in case of an reversible cell injury. And final our learning objective is to understand the ultrastructural changes because of the reversible cell injury. So let's start the discussion in the detail. Okay. So you might be familiar until now that whenever there is a injurious stimuli, as we have discussed, there are many causes for cell injury. So that injurious stimuli will lead to stimulation in the cell and the cell will undergo cellular adaptation, right? The first change within the cell is cellular adaptation. And if the injury is severe, then the cell will undergo reversible cell injury. It will injured, and that is known as reversible cell injury. And if the injurious stimuli is a persistent and in a high degree, then it can cause irreversible cell injury. So that is basic regarding the reversible cell injury. Okay. Now we will discuss the pathogenesis of reversible cell injury, that why reversible cell injury happen and what is the underlying mechanism. So guys, remember that the common mechanism that will lead to reversible cell injury is the ATP depletion. Your ATP will be decreased, the production of ATP will be reduced, and the common cause for the reduction in the ATP is the hypoxia. So that is the basic pathogenetic mechanism that will lead to reversible cell injury. I will explain you in the flow chart form, right? And the other mechanisms of the irreversible cell injury will be discussed in my another video. Okay. So guys, this is the beautiful image that I have written will show the pathogenesis of reversible cell injury, how reversible cell injury happen in our body. Okay. So the process is being start with reduction in the oxygen supply. So you will have the less oxygen supply, right? And the common cause for this hypoxia is the ischemia. And the common cause of ischemia is the arterial occlusion. So because of arterial occlusion by the atherosclerosis or any other cause, you will have ischemia. And because of ischemia, you will have less oxygen supply to the particular organs. Now, as you know that if your oxygen is getting reduced, then your mitochondria will not function properly and the oxidative phosphorylation within the mitochondria will be reduced. So you will have decreased oxidative phosphorylation. And that's the reason why your ATP will get reduced. So because of decrease in the oxidative phosphorylation within mitochondria, your ATP production will be decreased, and because of the reduction in the ATP, your sodium potassium ATPase pump will get failed. Now what is the remember the physiology, what is the function of sodium potassium ATPase pump? So here I have written the normal function. The normal function of this pump is to efflux of the 3 sodium molecule and influx of the 2 potassium molecule. So normally sodium will go outside the cell and the potassium will come inside the cell. That is the normal function of this sodium potassium ATPase pump. So if this pump is getting failed because of reduction in the ATP, then what happen? Exactly reverse scenario will happen. The sodium cannot go outside. So it will get collected within the cell. Here, just see in this figure. The sodium is getting collected within the cell and the potassium will go outside the cell. Because of the entry of the sodium, to maintain the osmolality, the water molecule will also come inside the cell, and so you will have sodium and water accumulation within the cell, and this water accumulation will swollen the cell, and so you will have the cell swelling, right? This is the important MCQ as far as the exam point of view, right? You have to remember. So that is the basic pathogenetic mechanism of the reversible cell injury by ATP depletion. Okay, so because of reduction in the ATP, you will finally have the cell swelling. So your first morphological finding in the reversible cell injury will be the cellular swelling because of failure of the sodium potassium ATPase pump. Remember this. This is the most important fundamental. Okay. Second, because of the reduction in the ATP, your another pump will also get failed, and that pump is calcium pump. So your calcium pump will get failed, so you will have more calcium within the cell, so your intracellular calcium level will get increased, right? And this increased calcium level will lead to activation of phospholipase enzyme. Now the name itself suggests phospholipase means it will lyse the phospholipid. So it will damage the phospholipid present in the cell membrane. Your cell membrane get damaged. Your phospholipid will get released, right? And this released phospholipid will bind with the calcium. There is a already excessive calcium levels within your cell, so it will bind with the calcium, and they will arrange in a lamellated form. This is called as a lamellated form, concentric lamellated form. So this concentric arrangement of the phospholipid and the calcium looks like an myelin sheath of your spinal cord, and that's why it is called as an myelin figure, the name given as an myelin figure. So your second morphological finding will be myelin figure, and that will be seen by electron microscope, right? Okay. Third important point, because of the reduction in the ATP, aerobic glycolysis cannot happen, so you will have anaerobic glycolysis. So your glycogen will get reduced, and you will have more lactic acid level, and because of increase in the lactic acid level, your pH will get reduced, so you will have less intracellular pH within the cell, and it will lead to nuclear clumping. So this finding can be seen in reversible cell injury, right? You will have anaerobic glycolysis, so more lactic acid will form, and you will have reduction in the pH, so there will be nuclear clumping. Okay, so guys, this is all about the pathogenesis of reversible cell injury. Hope you can able to understand the basic pathogenetic mechanism for reversible cell injury. See, the cell has not been damaged, right? It is in the reversible stage, so until now we can prevent the cell death if the injury stimuli is removed. Okay, now we will see which are the morphological findings in the reversible cell injury, right? So as we have discussed, the basic pathogenetic mechanism is the reduction in the ATP. That's why you will the sodium potassium ATPase pump will get failed, and you will have more water inside the cell, and that's why your cell will become swollen, and that is known as cellular swelling. So your first manifestation in the light microscopy in the reversible cell injury is the cell swelling. So that is the first manifestation. Okay, now see, in the all form of cell injury, the first finding is always cellular swelling because of failure of this pump. But only one exception is there, that is the apoptosis, in which the cell swelling is not the first finding, but your first finding will be the cell shrinkage. We will discuss why it happened in the apoptosis lecture, right? So in the apoptosis, first finding is cellular shrinkage. In all other form, there will be cellular swelling. Okay, so as far as the morphology of the reversible cell injury is concerned, basically the four type of morphological changes will be seen. Which are that four findings? The first one is cellular swelling, as we have discussed. Second one is fatty change. You will have the fatty change, right? Okay, at the third number, you will have hyaline change. At the third number you will have the hyaline change, and at the fourth number the morphological finding is mucoid change, right? We will discuss hyaline change and mucoid change in the separate lecture, right? Today we will discuss regarding the two main important morphological findings, that is the cell swelling and the fatty change. They are the two main morphological changes seen in the reversible cell injury. Okay, so the first morphological finding is cell swelling, right? Now, usually it is very difficult to interpret the cell swelling in the light microscopy. So, what the gross changes will happen because of this water accumulation, because of cell swelling? So, obviously, because of water collection, the cell will become swollen. You will have the swollen cell, right? So, your organ will be swollen. The weight of the organ will increase. There will be increased turgor of the particular organ because of the collection of water. And obviously, the more water will get accumulated, it will compress the capillary, so the organ will become pale. So that's the third finding. So three gross changes are seen: increased pallor, increased turgor, and there is an increased weight of a particular organ. So that is the gross changing. Okay, this is the microscopic finding. You can see it. What happened? Now, obviously, because of water accumulation, it will not have color. So you can see the cytoplasmic vacuolation. Within the cell, you will have the water collection. So it will be shown as an vacuole. So because of water accumulation, you will have cytoplasmic vacuoles. Just see. This is the cytoplasmic vacuole. Can you see it? This white color? This is the cytoplasmic vacuoles that is seen in reversible cell injury. This is the change in the hepatocyte, and it is known as ballooning degeneration, right? The another name of this cell swelling is the hydropic degeneration, because it is the change are because of water collection. So it is known as an hydropic degeneration and cloudy swelling. These are the another name: hydropic degeneration and the cloudy swelling. Okay, this is the microscopic image of the hydropic change in the kidney because of reversible cell injury, right? So here you can see, because of water collection, the tubular cells are swollen. These tubules is swollen, right? And it looks in white colored. Why? Because the water is getting accumulated. It will shown as a vacuole. So you can able to see the clear vacuoles, right? The vacuoles are seen. Just see, there is a presence of vacuoles, and your capillary will get compressed because of water collection. So your capillaries is compressed, right? So this is the vacuole. Just see, this is the vacuoles, right? Okay, so this is regarding the cellular swelling, hydropic degeneration, and cloudy swelling, right? Now, second important morphological finding is the fatty change in the reversible cell injury. There are two main morphological changes in the reversible cell injury. The first one is hydropic degeneration, and now the second one is fatty change. Okay, so name itself suggests, as like that of water, here lipid can get accumulated within the cell. So you will have triglyceride form of lipid accumulation within the cell cytoplasm. Principally, this change is encountered in an organ that is main deal with an fat metabolism. The organ that participate in the fat metabolism will principally get affected. So which are that organ that will participate in the fat metabolism? So obviously your first answer should be hepatocyte, right? Liver. The liver is the main source for fat metabolism. The fat mainly get metabolized in the liver, and another organ is myocardial cell. So this fatty change will particularly affect your two organ, liver and the myocardium, right? The hepatocytes and myocardial cells will show the fatty change. So guys, during the tissue processing, the fat is getting removed, right? So the fat will look and white colored. It will look and white colored, right? Like that of cloudy swelling. Here yellow color is not seen because fat is getting removed during the tissue processing, right? So first of all, as the fat is starting to get accumulated in the cytoplasm, it will get accumulated surrounding the nucleus, right? Suppose uh, this is your cell, right? And in the center there is a nucleus. So this lipid is getting accumulated around the nucleus, right? It will get accumulated around the nucleus. So the nucleus is seen centrally, and surrounding it you will have the fat accumulation, white colored. This is known as microvesicle. It is known by the name microvesicle. Okay. Gradually what happen, if the injury is persist, if the fat is getting accumulated again and again, then what happen, gradually the accumulated fat within cytoplasm will displace the nucleus to the periphery. It will push the nucleus. So gradually your nucleus will be at the periphery and the fat will get accumulated, right? So the cell with the fat accumulation and the nucleus at the periphery is known by the name macrovesicle, right? If again fat is getting accumulated, then what happens, the cell will start swollen bigger, it will become bigger and bigger, and you will have the more amount of fat, that is known as fatty cyst, right? Fatty cyst. So as far as the morphological finding of the fatty change is concerned, you will have microvesicle, then you will have macrovesicle, and finally you can have fatty cyst, right? So this is the beautiful figure showing you the fatty liver. Just see, this is the fatty change, right? You can able to see the macrovesicles. So this is the fatty change. Okay. We will discuss the causes of fatty change, right? Etiology of the fatty change in the separate lecture. I will explain you the fatty change in detail in the separate lecture. Okay, the common cause is alcohol. Alcohol also can cause cell injury, right? But we will discuss it later on. Okay, so this is regarding the light microscopic morphological finding of reversible cell injury, right? Now, if you will observe it within the electron microscope, so in the electron microscope, ultrastructural level, what will you see? Okay, so because of water accumulation, your mitochondria also will get swollen, right? With the small amorphous density within it. Okay, because of water collection, your plasma membrane will get altered, right? Your plasma membrane is getting damaged. The water is getting accumulated, so the plasma membrane will be altered and it will form the blebs or microvilli, right? It will form the blebs with the loss of microvilli. Your microvilli get lost and you will form the blebs over the membrane. I will show it in the figure as well. Okay, now third important ultrastructural change is that your endoplasmic reticulum will get swollen. So what happened? Remember the physiology. The ribosomes are attached to the endoplasmic reticulum end. So if your endoplasmic reticulum is swollen, then your ribosome will get detached from the it. So ribosome will get detached from the endoplasmic reticulum, and so your protein synthesis will be reduced. So your protein synthesis will be reduced, and finally you can have nuclear clumping and myelin figure in the electron microscopy, right? So these are the ultrastructural changes. Remember, because of plasma membrane alteration you will have bleb formation, the microvilli is getting lost, you will have the swollen mitochondria, you will have the swollen endoplasmic reticulum, so the attached ribosome will be detached, and so the protein synthesis will be reduced. Nuclear clumping and myelin figure can be seen. Okay, this is the figure showing the reversible cell injury, right? Here you can see that your endoplasmic reticulum and mitochondria is getting swollen, the ribosomes are detached, and there is a presence of myelin figure. Just see, it is a concentric lamellated collection of phospholipid and the calcium, that is known as myelin figure. Remember guys, it's a most important MCQ, right? You can see the myelin figure. Now if this injury stimuli is persists, the injury is progressive, then finally you will have cell death in the form of necrosis or apoptosis. Here you can able to see the blebs, This is the bleb. Just see protrusion, this cytoplasmic protrusion. You will have the bleb formation. Okay. And now I will teach you some golden points from this chapter, from this reversible cell injury. So, which are our golden points? So, the first point is the most common cause of cell injury is obviously hypoxia, right? And the most common cause of hypoxia is the ischemia. Okay, okay. Now, what happened? If you have the less blood supply, then every organ have different capacity to withhold from the ischemia. As far as the neurons are concerned, your brain tissue, right, the neurons, then they can withstand the ischemia. They can tolerate the ischemia only up to 3 to 4 minutes. If you will not correct the ischemia, if you will not correct the occlusion by the thrombolytic therapy, then within 3 to 4 minutes your neurons will get die. They will develop irreversible cell injury within 3 to 5 minutes, right? So neurons are very sensitive to ischemia. Second sensitive organ is your heart. It can withstand the ischemia for up to 20 to 30 minutes. So you have to treat the ischemia as far as the coronary artery is concerned within 20 to 30 minutes. So the heart will undergo irreversible cell injury within the 20 to 30 minutes of ischemia. Remember, neuron will die within 5 minutes of ischemia, while the heart cells will undergo irreversible injury within 30 minutes. So you have the 30-minute time to save the heart, right? Okay. Now you might wonder that which is the most resistant cell to the ischemia. So the most resistant cell to the ischemia is the fibroblast, right? So, guys, this is all about the reversible cell injury. We have discussed mainly regarding the pathogenesis of reversible cell injury, and we have discussed the morphological changes of the reversible cell injury. So, the basic pathogenesis is the reduction in the ATP, right? The main pathogenesis was reduction in the ATP because mitochondria not functioning properly because of hypoxia, and so your sodium potassium ATPase pump will fail, and because of that you will have more sodium and water collection, and it will lead to cellular swelling. The cell swelling and the fatty change are the two main microscopic morphological finding for the reversible cell injury. Grossly, your organ will be enlarged, pallor, and increased turgor, right? So that is all regarding the reversible cell injury. Hope my video will be beneficial to you in understanding the basics of the cell injury. Thank you guys for your attention, and kindly subscribe my channel if you like my videos, right? See you in the next video. Thank you very much, guys.